Hello again, everyone. I'm Caitlin Langhorn with ASTHO, the Association of State and Territorial Health Officials, here with another discussion about the SPACECAT. This is the last of our 3 videos about the SPACECAT, featuring comments from public health teams who have used it as part of our Spring 2021 pilot program. We wrap up with 2 important questions for the group. Here's the first one. What did you learn about your agency's capacity to collaborate between suicide, overdose, and ACEs programs? Carla or Amy, let's start with your thoughts about Tennessee's experience.
Amy and I did great on collaborating and working through and talking, but I realized internally when I'm asking 2 different sections and we may not be collaborating as intently internally with ourselves. So this really gave us an opportunity to recognize what that collaborative effort looks like and making sure that everybody is on board with each other's work so we know where our intersecting points are. It motivated me. I've changed our teamwork to where I have a section chief meeting now, and we look at some of the things that were in the tool regularly rather than just doing it when someone asked me. I was like, oh my goodness, we should be doing this constantly.
I think it was different sectors and pieces. It was kind of like a puzzle for us, realizing the work that is already being implemented throughout the health department, even in our WIC department. There's screening questions related to substance use disorder.
Gail or Sue, what was your experience in Michigan's Upper Peninsula?
Stigma is pervasive. We live in a very small rural area, and it is a challenge to overcome stereotypes and to kind of wade into some of these more softer public health issues. But I think when people understand, when direct care providers and public health employees understand that the person that you see in front of you who's challenged with, they're missing their appointments, or they're not accessing the public health services that are available to them, or they appear non-compliant, when they understand the backstory and they understand ACEs, the stigma drops, compassion rises, and people are treated with more respect and dignity, which improves our no-show rates. And it improves health outcomes. So one of the things that I think has been such a plus to looking at this tool is opening that dialogue and informing public health employees and informing even frontline staff about these things.
For our final question, we'd like to know how you think the SPACECAT could help other health agencies address the intersection of suicide, overdose, and ACEs. Jacqueline and Jillian, how has the SPACECAT helped further those discussions in Jefferson County, Missouri?
I think it could help other agencies just like it helped us because, again, it really helps you identify where are your individual strengths in those 3 programs or those 3 aspects, as well as where are the linkages and where are those gaps. And everything from how are you utilizing your data? How are you utilizing partners? I love that you had incorporated even those funding streams, because sometimes you can have the best ideas in the world, but if you don't have the funding to back it, your idea is only going to go so far. And that's usually not very far. So I think it really gave a broad scope of looking at all of those different pieces and helping us to identify those areas. And I think it could do that for every agency. I think even those outside of public health, any agency that works within these scopes, I think it could help them, again, identify where their strengths are, how they're working with partners to address where their gaps are, and how they can work together to meet needs of the community.
Same with me. I really got my wheels turning on where we are as a community. And what we need to focus on. Like if with community readiness, if we're ready to tackle, if we're ready to have a conversation about suicide prevention, we can really get out there or if we need to focus on education on exactly what that means, or, with substance use prevention, Narcan is kind of a hot topic around here. between law enforcement, community members. And so we actually kind of used information that we took on the survey through SPACECAT, and we kind of created our own community survey to send out to see, are people aware that this is a resource? What are their thoughts on it? And also used it to really identify gaps in other programs that we had.
Angie, Jennifer, or Jody, any thoughts about how the SPACECAT has helped you raise awareness among other agencies in Michigan?
So one of the ways that I hope that this can help other agencies is we collaborate quite closely with corrections and law enforcement now, and just kind of helping them expand their knowledge base as well as services that are offered to their incarcerated people's population. I think that helping them see what it means, what ACEs mean to the people who are incarcerated, how that has impacted their lives and how it's going to continue to impact their lives even when they're incarcerated is really important. And then that leads into the suicide prevention and the overdose prevention, both while they're incarcerated and after they're released. So I hope that we can continue to be good partners in spreading this information and providing it to those who still need it and maybe have never had it touch their system before.
Carla or Amy, how could the SPACECAT help you support this work in other agencies in Tennessee?
Well, one of the things that's part of our ACE plan across the state is integrating trauma and resiliency, trauma practice and resiliency into all of our 95 health councils, which it comprises the community. So if we're able to take this tool, and they always are looking for a way to assess what they're doing and see how they pull together pieces. I do think that we've talked on the ACE team about using a tool with our health councils that helps them be able to identify where all these crossroads are, because it's our treatment communities, it's our health community in each one of the areas of the state, it's our social service, our public-private partnerships, our businesses are all members of our health councils across the state.
That'll do it for our 3-video series featuring the thoughts of our agencies that took part this spring in ASTHO's SPACECAT pilot program. We hope you found the comments from Michigan, Michigan's Upper Peninsula, Missouri, and Tennessee helpful as you consider how SPACECAT can help you or others in your jurisdiction address the intersection of suicide, overdose, and ACEs. I'm Caitlin Langhorn for ASTHO. Thanks for watching.